Let us talk about cruciate ligament imaging. Cruciate ligament, there may be anterior cruciate ligament, may be posterior cruciate ligament. Anterior cruciate ligament, it attaches at the intercondylar fossa. In the intercondylar fossa, there are medial femoral condyle and lateral femoral condyle. It attaches to the lateral femoral condyle. And in the lateral femoral condyle, there are anterior aspect and posterior aspect. It attaches to the posterior medial margin of the lateral femoral condyle in the intercondylar fossa, and it distally attaches to the tibial intercondylar eminence, more specifically anterior aspect of the intertibial intercondylar eminence. Anterior cruciate ligament acts to restrain anterior translation, and it also restrain to a lesser extent internal rotation of the tibia relative to the femur. Anterior cruciate ligament visualized based on sagittal MRI, it normally appears as a fan-shaped bundles of taut fibers. There are two bundles in anterior cruciate ligament. One is anteromedial, another one is posterolateral. They may be differentiated on coronal and axial images. Why anterior cruciate ligament appears larger and of more mixed signal intensity than posterior cruciate ligament? Why it is larger and more mixed signal intensity than posterior cruciate ligament? The answer is the anterior cruciate ligament is interspaced. The bundles of the anterior cruciate ligament interspace fluid and loose connective tissue. That is, the fluid and loose connective tissue may be interspaced between the bundles of the anterior cruciate ligament, and that's why they are larger and mixed signal intensity than posterior cruciate ligament. Anterior cruciate ligament tear is a common sporting injury. Complete tears appears on MRI as discontinuity of the fibers. We may see we may not see the continuity of the fibers. The increased signal intensity may be seen in case of complete tears, and we also see laxity in association or in isolation. The mid substance of the anterior cruciate ligament is more commonly injured than the anterior or posterior aspect. In case of partial tears of the anterior cruciate ligament or sprains of the anterior cruciate ligament, appears on MRI as altered signal associated with laxity in the presence of continuity of some fibers, or the laxity in the presence of continuity of some fibers may be a sole presentation. There are some secondary imaging signs of anterior cruciate ligament. There may be microfracture. Typically, microfracture is present in the lateral tibial plateau and in the lateral femoral condyle. More specifically, at the posterior aspect of the lateral tibial plateau and subarticular aspect of the lateral femoral condyle, and they reflect impaction between these sides during subluxation at the time of injury, that is known as pivot shift injury. There may be associated anterior translation of the tibia. This is relative to the femur, and it can be detected on sagittal images, as it will cause buckling of the posterior cruciate ligament. So anterior cruciate ligament injury, there is a secondary sign that is buckling of the PCL. And why it is found? It is found due to anterior translation of the tibia relative to the femur. And on conventional radiography, anterior cruciate ligament tear may present as a lateral notch sign, but this lateral notch sign is specific but not very sensitive. That means if we do not find lateral notch sign, that means there is no anterior cruciate ligament tears. It is as it is very specific. But if there is lateral notch sign present, but it is not it is not sure that the anterior cruciate ligament is present, and it is called, and so it is not very sensitive. So this lateral notch sign, it describes as an abnormally deep indentation of the condylopatellar sulcus. The condylopatellar sulcus may be indented abnormally. So which condylopatellar sulcus? The condylopatellar sulcus of the lateral femoral condyle may be indented deeply, abnormally, and we may see this thing on lateral conventional radiograph as a lateral notch sign. Intercruciate ligament also associated with injury to other structures, and O'Donoghue's trials is one of them. O'Donoghue's trials triad composed of intercruciate ligament tear, medial collateral ligament tear, and medial meniscus tear, and a second fracture, which has a high association with anterior cruciate ligament. So what is actually second fracture? So it is the avulsion of a fracture fragment from where this avulsion occurs. This avulsion occurs at the attachment of the joint capsule, where the joint capsule attach at the lateral margin of the lateral tibial condyle, where the joint capsule attach at the lateral margin of the lateral tibial condyle. So let us talk about posterior cruciate ligament. Posterior cruciate ligament extends from the medial femoral condyle, more specifically at the lateral margin of the medial femoral condyle, to the tibial intercondylar eminence, more specifically to the posterior aspect of the tibial intercondylar eminence. Posterior cruciate ligament normally appears on MRI as a thick low signal bundle that is visualized in all planes of MRI. In tears of the posterior cruciate ligament, for example in sporting or dashboard type injury, this injury result in instability characterized by posterior translation of the tibia that is opposite to the result of anterior cruciate ligament tear. Here in posterior cruciate ligament, posterior translation of the tibia will occur relative to the femur, and in anterior cruciate ligament the mid-substance tear was more common. In posterior cruciate ligament, partial intersubstance rupture of the posterior cruciate ligament are more common than complete tears and avulsion, and these intrasubstance tears exhibit thickening and altered signal on MRI. So the posterior cruciate ligament may be thickened in case of intrasubstance tears, or the signal may be altered. So two findings: one is thickening, and another one is altered signal intensity. And in case of intersubstance tears, the continuity of the structure is maintained, and typically posterior cruciate ligament has association with microfracture of the tibial plateau, more specifically the anterior aspect of the tibial plateau. And there are some other soft tissue injury associated with posterior cruciate ligament, such as the tears of the anterior cruciate ligament may be associated with it. Medial collateral ligament may be also associated, and posterior lateral corners are soft tissue injury to the posterior lateral corner are also associated. So this is all for today. Thank you for listening.